Okay, good good evening to all of us. We are welcome once again to video. Good evening once again. We are welcome to today's class. We're starting, so some of the friends that have not joined, you can just encourage them to join. Afterwards, we would still send the video to the class group so you can still join from the class group as well. So the other time we looked at terminologies that is used in surgery and surgical nursing, and we appreciated that we can have certain terms that we are going to be meeting on as we go. So we just had to go through those terminologies in order for us to be abreast ourselves with some of the terms that we'll be meeting. So apposition, fracture, wound, skin lesion, inflammation, and all that. I hope you have revised so we can move on to today's work. So today we're looking at surgery and surgical nursing. We are introducing ourselves properly to the course. So that is the subtopic for today. So this is our course objective. By the end of the topic, the student should be able to define surgery and surgical nursing, state the purpose or reasons for surgery, and then why are you going through surgery? There's a need for whatever that we do. List the classifications of surgery or surgical indications. So we are going to classify surgery or surgical indications, and then describe the theater setting or design. How does the theater look like, or how is it supposed to look like? And then describe the special operative areas that are found in the theater. List and describe the uses of theater attire. So what we wear at the theater, we are supposed to be able to list and describe it. And then state the members of the theater team and their function. So any member that is part of the theater team and his or her function. So the doctor, the surgeon, nurse anesthetist, or the anesthesiologist, nurses, students, any other personnel who is part of the surgical team. We are going to list it, or we are going to list them, and then we are going to list their functions. So we're starting off with the definition of surgery. So surgery is a procedure that involves cutting of tissues or closure of previously sustained wound. Or surgery is defined as the treatment of injuries or disorders of the body by incision or manipulation, especially with instrument. So we're looking at a proper definition of surgery whereby body parts are manipulated and repaired, whereby we treat injuries, disorders by incision, especially with instruments. So as we're dealing with surgery, what we're going to look at is using instruments to be able to treat certain conditions. Okay, so sometimes a patient may have a problem and we are supposed to use instruments. We incise the individual, and then we treat the person. Any form of congenital malformation, disorders that are found that we can use surgical means to treat them, we use that. So surgery comes from a Greek word. Many a times, all these English words are coming from either Greek, Latin, or sometimes Greek and Latin just combined together. So surgery in Greek, kuturia from the Greek word chair, hand plus urgent means work. So simply, when we say surgery, surgery is hand work. Okay, so we use the hand to be able to manipulate with the help of what? Instruments. So it's a branch of medicine that deals with physical manipulation of a bodily structure to diagnose, prevent, or cure an ailment. So it's a branch of medicine which deals specifically with how the body works, how the body is supposed to be manipulated, how whenever there's a problem with the body, how do we diagnose it, how do we prevent it, how do we cure such ailments. So in such an instance, this is a handwork that we use in dealing with the manipulation of the bodily structure. So anatomy and physiology is the study of the body parts and its related functions. So in surgery, we look at this body parts, their related functions. If there are any problem with any of the body parts and its related function, we diagnose it, or even we prevent those conditions from coming at all, and then we can help cure them when they do arise. So therefore, that is surgery. So in our aspect, we're dealing with surgical nursing. So the definition of surgical nursing is a branch of nursing which focuses on the care of surgical patients. So surgical patients are patients who have gone through surgical procedures. So if we are focusing our care on such individuals, then we're looking at surgical nursing. So the care that we give to patients after surgery or before surgery or during surgery, that is what we're looking at as surgical nursing. So surgical nurses may work in pre or post-operative care unit as well as operating theater, and they are very important part of surgical care theme. So yesterday, the last time we met, we spoke about pre-operative care and post-operative care. So we rightly said that the pre-operative care are the care or preparation that is given to a patient prior to surgery before the person goes through surgery or surgical procedure, and the post-operative preparation or care are the care that is given to the patient after the patient has gone through a successful procedure. So in a preoperative care, the nurse helps prepares the patient for surgery by preparing the surgery site, preparing the room, preparing the area, looking for medications, what that we are supposed to give to the patient so that we can prepare the area, the site whereby the operation or the surgery is going to take place so that we don't infect the individual. During surgery, the nurse assists the surgeon with surgical procedure. A circulating nurse monitors the use of surgical instruments, sponges, and other materials to make sure that nothing is left inside the patient. So when these procedures are being done, we're supposed to have a surgical nurse, or we call a circulating nurse, to be around to count the total number of instruments that are being used. So sometimes they have a white board that they write all these things on it with markers. So at the end of the procedure, we have to make sure that we don't leave anything inside the patient, or let's say within the patient, or in instances whereby a whole gauze has been left in the patient's abdominal cavity. Some surgical instruments have been left in the patient's abdominal cavity. So certainly we expect that the patient will certainly die after the procedure. So after the surgery, the nurse monitors the patient's recovery by checking the vital signs, dressing the patient's wound, and looking out for other devices. So if, for example, we talked about prosthesis, artificial part of the body that is placed within the individual. So the nurse also monitors for infection and other complications. So after the surgery, if there's any form of infection, it is the responsibility of the nurse to be able to monitor all these things. Other complications that may arise after the surgery, all these things are monitored and done by the nurses. So surgical nurses may practice in different types of surgery or may involve themselves in different types of surgeries, which may include general surgery. Example, as we talked about the other time, appendectomy, removal of the appendix, gallbladder removal, and all that. So a nurse may assist a surgeon to this procedure. Vascular surgery, that is surgeries in relation to varicose vein surgery, aortic aneurysm repair, and all these things. Anything that is in relation to the heart, the nurse can help that. And then colorectal surgery, example, stoma formation, creating artificial hole at the part of the abdominal cavity so that waste materials can be collected. So example, colectomy is done around the area. So surgical oncology. Oncology has to do with cancers, tumor. So for example, breast surgeries, tumor resection, cutting them out, replacing all these things. So all these things, surgical oncology, breast cancers, prostate cancer, all these surgeries that are done by surgeons, nurse may help to do these surgeries. Orthopedic surgery has to do with bones. So example, a knee or hip replacement, a fracture repair, an internal fixation, an external fixation, example, plaster of Paris or POP, or cast when it's being molded around a fractured area. All these things are orthopedic surgeries that nurses can partake. Urological surgeries in relation to the urinary system. So example, prostate surgeries, everything, all those things that are being done, nurses can partake. Day surgery or ambulatory surgery where a patient is discharged within the first 24 hours. So certain surgeries, just after the surgery, a patient can be discharged within the first 24 hours, then the person can go home. So why do we even do surgeries or perform surgeries, the purposes of surgeries or reason for surgeries? One typical reason for surgery is to eliminate what is superfluous or to eliminate which is superfluous. And when we talk about the meaning of superfluous, we're looking at anything that is unnecessary within the individual body, okay, especially something that we say surplus, okay. So let's say an individual may have about 6 fingers, dig it. So here it is superfluous, it's unnecessary, you can just take it off. Anything that feels so unnecessary or feels surplus in the part of the body is termed superfluous, so we can eliminate it. So sometimes through surgery, a part of the body can be taken. So for example, some time ago, a mother gave birth with a child with a tail. So in such an instance, the tail is just superfluous. It is not needed, it's unneeded. So the best thing that can be done is just what? To just excise it out and just take it off. Another reason for surgery is to restore what has been dislocated. So any part of the body that has been dislocated, we have to restore it to a proper function. So let's say that if you have a fracture, meaning that the proper way for which the bones are supposed to be located have been dislocated. So we have to put it back in its norm. Separate that has been united. So certain things have already been united. So it is the responsibility of surgeons to be able to separate them. Example with Siamese twins that are born together. So probably they are sharing some part of a body. They are sharing an organ, an internal organ or something. So it is the responsibility of surgeons to do such surgery. Some parents decide to do it, others also decide not to do it. So certain things as that could be separated with what we surgery. Join that which has been divided. So if we are separating which has been united, which is abnormal, then they can also join that which has been what? Divided. So certain things or certain part of the body that has been divided can be joined. So example, we can have cleft lip, cleft palate, and all those things. It has been divided. So it is the responsibility of surgeons to be able to repair. So now we have cleft lip repair, and I think it's free for now. Repair the defect of nature. So as we just said, you can have certain defect of nature. People can be born with an imperforate anus, it's a defect of nature. Hole in heart is a defect of nature. It's a congenital malformation. So here, with such instances, the best thing that can be done is to repair these defects of nature. So now we're looking at classifications of surgery. Surgical procedures can be classified based on if an individual is supposed to go through surgery, you are supposed to classify the procedure based on these 3 main things. How urgent is the surgery? How risky the surgery is, and the purpose of the surgery. So urgency as a classification, risk as a classification, purpose as another classification. So we have 3 main classifications of surgery: urgency, risk, and purpose. So classification based on urgency, we can talk about elective surgery, urgent surgery, and emergency surgery. When we talk about elective surgery, certain surgeries are planned based on patient's choice and availability of scheduling for the patient. So surgeons and other facilities may not be available. So here there can be a delay of surgery in certain circumstances or instances. So therefore we can plan the surgery and then the individual may come back later to come and do the surgery, or sometimes cost, facility availability, as I spoke about earlier, may be some of the reasons why certain surgeries could be planned. So, for example, hernia repair, cataract extraction, tonsillectomy, the removal of tonsils, and hip prosthesis. All these things are some of the types of surgeries that can be done electively, can be planned, and later can be done. Urgent surgery must be done with a reasonable short time frame to preserve health, usually done within 24 to 48 hours. Example are removal of gallbladder, amputation, appendectomy, and etc. So it looks like it can be planned, but it's supposed to be done within a stipulated frame of time, a short frame of time. That is why we say within 24 to 48 hours, this or such a procedure is supposed to be done. And then the last one is emergency surgery. As the name goes by, emergency must be done immediately to preserve the individual's life, must be done immediately to preserve a part of the body. Okay, so sometimes an individual may have inadequate supply to a part of the body for which all those things are supposed to be done immediately. Either than that, the individual may lose that specific part. So example is control of hemorrhage or bleeding. I mean, that one is supposed to be done immediately because the individual may lose a lot of blood. The person may go into hemorrhagic shock and as well as hypovolemic shock. So in such instances, hemorrhagic shock is when an individual loses a lot of blood, and hypovolemic shock is when an individual loses blood and fluid at large. So here, if an individual is bleeding excessively and we do not control this bleeding quickly, there's a possibility of an individual going into shock, and then the person may also die. Repair of trauma, when there is any trauma, severe trauma to a part of the body that may affect a vital. So that is based on urgency. So the next classification is based on degree of risk. How risky is the procedure? So we classify surgery according to the risk. Certain procedures are not risky, meaning that if they are not risky, an individual's life is not at stake. But certain procedures are very risky, an individual's life is at stake. So we classify surgery based on risk in two main ways. So we can have a major surgery, and then we can outrightly have a minor surgery. In major surgery, surgeries require hospitalization and specialized care. And then most of the time, the surgery is usually prolonged. It also has a higher degree of risk. It involves major body organs, and it is also life-threatening situations, and has a greater risk of post-operative complications. That is, after the procedure, there's a possibility of greater risk of post-operative complications. So examples of such major surgeries are open cholecystectomy, so meaning that the bladder is going to be opened, an individual body part is going to be opened, whereby we are going to look at what is wrong with the individual and then check if things can be done. Okay, so surgically we are going to remove the gallbladder. Okay, so it's an open, we are going to cut open into the abdominal cavity, remove the gallbladder if it is diseased. Nephrectomy, the removal of the kidneys. We are looking at hysterectomy, removal of the uterus, radical mastectomy, removal of the breast, and all that. So all these things are some of the examples of major surgery. So meaning you can see that major organs are involved. A lot of blood is going to be lost, and then it's going to have or come with post-operative complications. So this is what is going to make, and it's a life-threatening condition. If anything happens and then nothing is done about it, there's a possibility that the individual may lose their life. So for example, the laparotomy, whereby we just cut through the individual abdominal cavity and get access to the individual abdominal cavity and do our own surgery, do whatever that the individual will do. With minor surgery is usually brief, carries a low risk, and then the results most of the time comes with few or no complications at all. Less blood is lost, Major organs are not handled. Minor surgeries are mostly elective. Go. Teeth extraction. You can go and come back later. The tooth could be extracted for you. Cataract extraction or removal. All these things are done. They are minor surgeries which a lot of organs are not involved. The third one is based on purpose. So we do surgery based on purpose. So we do surgery based on diagnostic purpose. We use it to diagnose to see whether an individual has certain conditions. Ablative surgery, we're looking at palliative surgery, reconstructive surgery, transplantation, and then constructive surgery. So with the diagnostic surgery, we do diagnostic surgery to confirm a diagnosis. Example, we take a biopsy, bronchoscopy, endoscopy. So we take a biopsy of a sample of, let's say, a tumor to be able to see if it is benign or malignant. Let's say it is cancerous or non-cancerous. So we take a biopsy, a needle is inserted, so that we can see to confirm that the individual has cancer or not. With ablative surgery, surgeries are done to remove a diseased body part. Example, appendectomy or amputation is done. So the appendix is removed, it is diseased, it is inflamed, it has been affected. So we don't want this infection to get access to the various parts of the body, or let's say become systemic. So therefore, we take that part of the body that is diseased. People do removal of the kidneys, they just remove a part of the kidney that is diseased, they just remove it out, an amputation. With palliative surgery, surgeries to receive or reduce intensity of an illness. It is not curative with palliative care. What happens is that sometimes we just use it to we just use palliative care to alleviate pain, to relieve pain, to reduce the intensity of pain or illness at a particular area, but it is not for curative purposes. So, for example, cholecystomy. So, for example, the colostomy, as we said earlier, bringing an end point of the colon, divert it through the abdominal cavity, creating a hole out so that waste products can just come out. We are not curing a condition, but we are reducing the intensity of the condition. Then we can also look at nerve root recession, and all these can be palliative care. The fourth one is reconstructive surgery. With reconstructive surgery, surgeries to reduce or let's say restore function of a traumatized or malfunctioning tissue, or to improve self-concept. We are reconstructing. So scar reversion, plastic surgery, people change their nose, making their tummies flat, having breast implants and all that. Here it is not, they are just using it to restore a function that is traumatized or that was traumatized, or just to make sure they improve a self-concept. They are okay, they want to look good. Breast reconstruction and etc., or all type of reconstructive surgeries. And then the last one that we can talk about is transplantation surgery. Surgeries to replace organs or structures that are diseased or malfunction. An example, transplantation of kidney, liver, heart transplant, and all those things. So these are some of the classifications of surgery based on purpose, based on urgency, based on risk. So these are the classification and the examples under them. So we can also look at constructive surgery. We talked about reconstructive, so now we are looking at constructive surgery. So constructive surgeries are surgeries to restore function in congenital anomalies. So for example, we have cleft lip repair, as I said, closure of arterial septal defect earlier on. We talked about all these things earlier. So we are constructing it. The individual has a problem with it, hole in heart and all those things. So we have to construct it for the individual. So now we're looking at the theater setting or the theater design. The theater is designed to create a realistic traffic workflow patterns for patients, visitors, personnel, supplies. Because sometimes somebody is coming for surgery, the person will be bringing a lot of people and stuff. So here, to reduce the workload at the area, it's the responsibility of the nurses to be able to make sure that they restrict the patterns of patients, the visitors and personnel over there, so that they can have a proper way to be able to deal with whatever surgery that they want to do. So it is therefore divided into 3 zones. So we have the unrestricted zone, semi-restricted zone, and the restricted zone. Unrestricted zone, semi-restricted zone, and restricted zone. So when we talk about the unrestricted zone, we're looking at the patient's reception area, changing room, stores, offices, whereby this area is isolated by doors from other areas. So you just open this door, you get to the stores, you open this door, you get to a changing room, you open this door, you get to the patient's reception area. Okay, so this is an unrestricted zone whereby proper sterility or sterile techniques are not really properly taken into consideration there. So this is an unrestricted zone. So what you can see over there is the red line. Where the white chap is more restricted. Where the black slippers is not restricted. So most of the time it's just divided with a red line. So you see that red line and you see that those are unrestricted zones. Above the red line, you have a restricted zone. So the next one is a semi-restricted zone. Semi, it looks as if it's restricted but not always restricted. So this area is permitted to properly dress and authorize personnel only. So if you are not a staff, there's a possibility you are not going to be allowed to a semi-restricted zone, or you have to dress properly before you are allowed into a semi-restricted zone. So scrub suits and head coverings are required to a semi-restricted area. So this area includes the peripheral support areas and access corridors to the operating rooms, storage areas for clean and sterile supplies, work areas for storage and processing of instruments. So all these areas are semi-restricted areas. So most of the time, it is the staff that get access to these areas. And this picture is depicting a semi-restricted area. Sometimes you can have a semi-restricted, a restricted area in a semi-restricted area. For example, if you can see on the screen, the red line over there is showing a very restricted area. Out of the red line or the red zone, any other thing that you see over there is a semi-restricted area. But you are supposed to be in the proper attire before you can get access to the semi-restricted area. And then the third one is a restricted zone. This area is permitted to personnel dressed in scrub, suit, head coverings, and mask. So now that we have the coronavirus, you can see a lot of people with masks and all those things, but those things are supposed to be used for a restricted zone in the theater or at the theater. So this area includes the scrap up areas, the operating rooms, that is the OR, sterilization areas for unwrapped supplies. So where these items that we use for the surgeries are unwrapped, we clean them, we put them there. This area is very sterile. So if an individual is very unsterile, there's a possibility that the person is not going to be allowed. That's why we have only few personnel that are permitted at this area. So you can have this whole area as a restricted zone. So meaning they are just divided by doors. So you push this door, you push that door, then you get access. So this is an OR, this is an operation room, a typical operation room. You can see have the couch or the operation bed there. We have other items. You can see the oxygen, the drip stands, the monitors, the lights, everything is supposed to be readily made available. So this is restricted only to personnel that are supposed to be there or are in proper attire. So this is a typical one, another picture. These are the items that we're talking about, the items on the green towel. The individual is properly strapped and then he's found in the restricted zone. So there's a surgery going on, and as you can see, the surgeons or the theater team is at work, and the items that are placed on the trolleys are very sterile, and the patient is lying in bed, and then this surgery is being performed for the patient. So we have special preoperative areas within the surgical area. So the first one, we can look at the check-in unit. So the check-in unit is another unrestricted zone. So upon arrival, people may have cubicles, curtains, lockers, washrooms at an area which is very individualized, whereby an patient coming for surgery would have to go check in shortly before the surgical procedure is done. From the check-in, then we move you to the holding bay. This area is designated and designed probably to wait for the individuals that are going for surgery. So it may be separated from the surgical suite or situated just adjacent to it. So it is not going to be within the OR, that's the operation room. So most of the time it is a little bit further, whereby patients are kept, everything is prepared before the patients are brought. So this a typical holding bay, can have beds waiting for it. And then there must be individual cubicles for each patient. Every patient is supposed to have their cubicles. Emergency cart, drugs, defibrillators, oxygen apparatus, suction machine, devices, monitor, cardiopulmonary resuscitation kit or devices are supposed to be made readily available in case the patient goes into shock. Then we can resuscitate the individual back. So pre-medication given to the patient and surgical shift preparation is performed if required. So we give pre-medication if it is needed. We do surgical shaving. Other procedures such as passing catheters, NG tube, intravenous transfusions are all administered if it is needed prior to the surgery. So we have the anesthesia room as another special area. So here most of the time the room is only for the anesthetists, the anesthesiologists or the nurse anesthetists. They are supposed to be there. Sometimes you can have theaters, and then you can have a room within the OR, that's the operation room, which is mainly for the anesthesia purposes. But sometimes you can also have an office mainly for anesthesia. So the individual goes in there, take the anesthesia, and come back to the OR. So a room that is normally adjacent, or where a patient is prepared before administration of some types of anesthesia. So you can have a general anesthesia and a regional anesthesia sometimes are given. So this is a typical anesthesia room. So a patient is just sitting on the bed, and then the anesthesiologist is just administering the anesthesia to the individual, so through the lumbar vertebrae. So spinal anesthesia is being given. So theater floors, all furniture and equipment and personnel clothing must be free from dust, moist and debris. Movement of personnel and opening of the doors lead to increase in microorganisms in the area. So in certain facilities, especially with the OR, there's not supposed to be any window. So a proper OR is not supposed to have a window. It's supposed to be windowless, so less ventilation coming out. So most of the time what they do is that they have air conditions in place just to stop the multiplication of microorganisms in the area. So air pressure in the operating room itself is kept by ventilation at a higher level than that of the surrounding corridors. So within the corridors, you are sometimes going to have lower temperatures, but higher temperatures. But within the OR, you are supposed to have very, very low temperatures just to stop the multiplication of microorganisms within the area. So to keep the air movement in the operation room at minimal, no windows should be opened to allow air into the room. Windowless room is ideal, as we said earlier. So windowless room is ideal for all operating theaters. But most of the time, people rent places for their clinics, so windows are already there. In such instances, the windows are not supposed to be opened at all. So we're looking at the theater attire. So what you're supposed to wear when you are in the theater, or when you find yourself at the theater. So scrub suit or attire, head coverings, your hair is supposed to be covered, mask, footwear, gloves, face shield or goggles, and surgical gowns. So we show you a picture soon of an individual. So this is what we're talking about. She has a cap, face mask, and then suits, and then the footwear. So the hair coverings are supposed to cover the hair so that it doesn't get access. The mask to make sure that you filter out particular microorganisms, including bacteria, virus, and fungi from exhaled air. And then they may be disposable or reusable. So you can have a disposable mask or reusable mask. Preferably, most of the time, people use disposable masks. So surgical masks must be worn as supposed to be worn at the surgical areas. Surgical gloves are supposed to be worn at the surgical areas because we are looking at a sterile procedure. So surgical gloves are supposed to be worn. Single-use gloves are not needed at the areas. So hands must be washed when gloves are removed. Wearing two pairs of gloves provide additional protection for the scrub team. Okay, so people do double gloving because most of the time gloves get torn. Eyeglasses or goggles must also be used shield to prevent splashing of materials getting into contact with the eye. Face shield must be used whenever power saws, drills, or irrigation is used. So when you are suctioning, when you are drilling, when you are using power saws to cut a part of the body, face shields are supposed to be used because it may splash. So surgical gowns are supposed to be worn by surgical team members to prevent the transmission of infection from the team members to the patient and from the patient also to the team members. So that is the need. So this is a proper strapped individual. So you can see with the hair, it is covered, nose covered. She's not wearing a goggle though. She has gloves on. She has aprons, her shoe, and everything is accurate. So what or who make up the theater team? So for a theater team to be put up, the surgeon is needed who sole primary function is to perform the operation or to perform the procedure. May also have people to assist or may delegate some of the responsibility to surgeon assistant or perioperative nurses to help. The surgeon assistant may be available to perform certain activities such as handling tissues, providing exposure, that is opening up the area for the surgeon to be able to operate on, suturing and providing hemostasis at the environment so that you can get a clean area to dress up. The anesthesiologist is a physician who specializes in administering anesthesia to the patient. So before a patient goes through surgery, anesthesia is supposed to be given to the patient to numb the area so that the individual doesn't feel pain. So anesthesiologist or the nurse anesthetist is responsible to administer these things. So between procedure before the procedure is done. So we have the scrub nurse who is also responsible. So let's look at the responsibility of a scrub nurse. So during the surgery, they hand appropriate instrument to the surgeons, anticipate the need for the surgeon, whatever the surgeon may be needing at any point in time, so that they go hand in hand with whatever that may be happening. Keep operative field tidy, so that the place is not supposed to be messy with blood and other fluid. Maintain sterile field throughout the procedure. Covered exposed abdominal content with warm abdominal sponge and remove all loose swabs away from the operative side. So that is the responsibility of the scrub nurse during surgery. So after the surgery, it is the responsibility of the scrub nurse to clean up the patient, cover the patient with clean sheets, send the trolley or bed and other accessories to the appropriate areas, assist to lift patient onto trolley and accompany patient to recovery, and hand over document to ward nurse, including specimen. So any specimen that was taken from the patient, whatever that was done during the surgery, after the procedure, it is the responsibility of the scrub nurse to hand over all these things to, and then they tidy up the area. So we have the scrub nurse and then the circulating nurse. So before the procedure, it is the responsibility of the circulating nurse to confirm the operation list. Who is coming first, who is coming second, what procedures that are supposed to be done at which point in time. Check and ensure all appliances are working. Arrange items to be used for surgery in the theater. So it is they that make sure that everything is in accordance. They are making sure that everything that is needed for the procedure is rightly made available. Cross-check patient particulars with that on the operation list. If this is the appropriate patient, this is the appropriate surgery that we are supposed to do, appropriate instrument, and everything that is supposed to go on so far as the surgery is concerned is also handled by the circulating nurse. And also send the patient into the theater when the patient is also ready. Assist scrub nurse so they also assist the scrub nurse to count swabs, sutures, instruments opened and record on a board. So as I said earlier, they count every instrument that they are going to use, every swab that they are going to use, so that they don't leave it within the patient. So at the end of the day, they count it back to be able to cross-check to see the other instruments that they used, make sure they pick a bucket, they put everything, they have receivers, they have swabs, and everything that is supposed to go on. So the circulating nurse during the surgery helps direct operating light to where the light is supposed to go, whether deep, shallow, okay, receive labels and preserve specimen. So record the type of irrigation fluid that was used, the fluid that was used in splashing, keep operating room tidy and maintain order. They also assist in wound dressing and tidying up patient. They switch off operating lamps. They suction every suction that is used, anything, and when they finish, they decontaminate everything. They dust and tidy up the operating room and prepare theater for the next case. And then they document all consumables that were used as far as the surgery was concerned. So, in the nutshell, we've been able to look at various indications for surgery, reasons for surgery, classifications of surgery. As we said, we have three main classifications of surgery: surgery based on urgency, risk, and purpose. And under the urgency, we said that we can have elective surgery, urgent surgery, and emergency surgery. And then based on risk, we can talk about major and minor surgery. Based on purpose, we can also look at diagnostic surgery, ablative surgery, palliative surgery, reconstructive surgery, constructive surgery, and transplantation surgery. So, on this note, we have concluded the class today, and I am very happy we've been able to go through such a wonderful session for today. So now we can define what surgery is, what surgical nursing is, the classifications of surgery, the need, the purpose, or the reason for surgery. And then we look at the theater design or setting, the essence of the theater design and setting, having a restricted zone, having an unrestricted zone, and having a semi-restricted